Jax is back. Hopefully whatever it is you're doing, it's a little different than it was yesterday. And I know it almost feels as if it's Groundhog Day. You all remember that movie, and we're just going through the same motions, only on a different day. And each day we get some different news. So I thought that I would do a little special on who we turn to during times like this. Of course, in my first podcast and my second one, talked a little bit about faith over fear. And I haven't really gotten into family and friends and things that matter the most. So I'm going to focus on who I turn to 9 times out of 10, and that's my best friends. Some people are lucky enough in this world to get one best friend. I was blessed with 3 best friends. We all have different kinds of friends, whether they're acquaintances, co-workers, friends. There's different types. So I want to focus on my best friends. And like I said, there are 3 of them. And what makes everything so different about these 3 friends that are my best friends is that we've known each other since we're 5 years old. That's quite some time. Because when you do the math, I think we start at 49. Janine is 49. She'll be 50. We have Heather, who just turned 50. We have Debbie, who is 51, soon to be 52. And I, myself, am 51. So we're all around the same age, and we've all known each other, again, since we're 5 years old. We lived within, I'm going to say I was the furthest away. Maybe about 200 yards I lived away from them. And Heather, Debbie, and Janine, and you can say that all in one breath, or at least I could, because I used to say it every single day, and I still do. They lived within a stone's throw away of each other. So we were together an awful lot. And we still turn to each other in good times and bad times for whatever the case may be. All for different reasons. My best friend, Janine, she carries her faith in her back pocket and in her heart like no one that I've ever seen. She bleeds faith, and she is a good friend to have. She is a school teacher with 2 children of her own. One who was supposed to be graduating from high school. So we're there for her to back her up, and we know exactly what she's going through. My best friend, Debbie, she is divorced, a single mom of Danny, who is just an unbelievable kid. They both work for the Yingling Brewery. Debbie just found out that her mom had been diagnosed with some unfortunate news. And we're kind of waiting in the wings to hear what's going to happen and keeping positive thoughts sent her way. Heather, who is an incredible, brilliant individual, is the person who this podcast is going to focus on today. Heather, who just turned 50 years old, has a daughter and an incredible husband, Steve. And I decided to ask Heather, who is my go-to when I have any kind of health scare, health issue, health question, you name it, I turn to Heather. But not just for health. She happens to be the one that I go to that kind of straightens me out when I say, I don't know what I'm going to do. I need your help. And she is pretty straightforward with everything that she has to say. She doesn't bullshit anybody, and she says it like it is. So therefore, I thought it was a good time to turn to Heather and her thoughts on COVID-19. She's a registered nurse who is currently working in administration in the Department of Surgery at a hospital in Philadelphia. And I wanted to ask her thoughts and opinions. So this is what you're going to hear in her words, because we used social distancing because of the fact that I wasn't going to go to Philadelphia and we weren't going to do this face-to-face. So she put her thoughts into writing for me. And for you, and I think that they're really important to listen to. And her first reaction when she's asked about COVID-19 right now is that she doesn't think enough people are taking it as seriously as they should be. We're all hearing this on the news. Coronaviruses aren't new. They're a group of viruses that cause respiratory symptoms, think cold symptoms in this strain, that produces the illness COVID-19. That is new, and we don't know many things about how this virus behaves. What we do know is that it can be deadly for certain populations, more often the elderly and immunocompromised or those with underlying conditions. And we know that it can be spread to those populations by people who don't have symptoms. That's what's key. Even if you may only have mild symptoms, you can pass it on to someone for whom that will not be the case. There are cases of families losing multiple family members to this virus, for instance, in New Jersey. Some deaths in younger age populations, perhaps only because she turned 50, as she says, and I just mentioned, that she's considering herself a younger age. So the first thing you have to ask yourself is whether you want responsibility for transmitting what could be a deadly virus to your family or friends, let alone to strangers. She says you need to focus on what we know we can do to prevent transmission. If you're sick, stay home. If you need to talk to your doctor, call the office first. Don't just show up if you have a cough, fever, and think you've been exposed. Or if you have recently traveled. If someone develops symptoms requiring urgent medical care, call 911 and let them know if you're worried about COVID. Stay away from folks other than those who you live with right now. Social distancing is the new buzzword. If you're around others, stay 3 to 6 feet away. That allows any droplets to fall before they can reach you. Frequently wash your hands for 20 seconds or use alcohol-based hand sanitizer. If you can't use soap and water, which is the best alternative option, cover your mouth and nose when you cough. Sneeze, not with your bare hand. Turn the water faucet off with the paper towel you use to dry your hands so you don't recontaminate your hands on the dirty faucet. Turn off light switches with your arms. Do everything you can do not to touch things with your hands. And stop touching your face. That ushers the virus into your mucous membranes, which is how you will get sick. She says she would also advocate for eating well and sleeping well. They both bolster your immune system. All indications are that we in the United States have not hit our peak. It's going to go up before and because of spread, but also because of increased testing. So don't focus on the numbers, except the one that shows how many people have recovered and the ones that are indicating that there does seem to be slowing spread in some areas. Seeing a lot of hospitals getting prepared for an onslaught of cases that will need critical care in some cases. Remember, not only do we not want to overwhelm the hospitals with COVID patients for that reason alone, but there are still others to care for. So what does preparing mean? Canceling elective surgeries, discharging people as soon as it is safe, and postponing outpatient visits for as long as we can. These measures also help us have fewer people in the hospitals, again, helping to reduce transmission. We have done inventories of supplies and equipment, she says. Some are taking temperatures of folks entering the buildings, doing work to identify all the nurses and other healthcare professionals who no longer work in direct patient care, but are still licensed. Moving to telemedicine, something that has been started for office visits, but now has really been ramped up. Identifying areas that could isolate COVID patients and where else they might care for non-COVID patients. There's also so much to plan for quickly, and it looks and sounds like our healthcare systems are rising to the challenge. Very nervous about whether they will see spikes like Italy has seen. There's a lot of anxiety. People are worried about contracting COVID-19, but also about transmitting it to friends, family, patients, co-workers. They're worried about whether it is safe to take public transportation. They worry about whether the financial impacts to hospitals will ultimately cost jobs. How many will die? Will it be people we know? Are kids protected from it as they seem to be? The list goes on and on. And what she tells people is, and what we're hearing today, the reality is that out there, it's being transmitted. So you may already have been exposed and been asymptomatic. Behave as if you haven't been and don't want it, doing all the protective things that she's mentioned. And if you get sick, take it seriously. Isolate within your home to protect your family. And certainly no leaving the home unless you need medical care. And then warn your providers ahead of time. Hopefully this will be over sooner than later, but We just don't know right now. It's a new virus, so no one has immunity unless you're one of the hundreds of thousands who have been infected. And we don't know if it will die off with warmer weather, or maybe it'll like warmer weather. So what to expect or do? Heather's thinking is that we need to stay flexible and resilient. Everything is changing rapidly. You have to go with the best flow right now. We may be through it in a few weeks, which is the very best case, or a few months, or it could be longer, or it could be in waves. We tamp it down, then we let people socialize and it peaks again. So we need to reinstitute social distancing. And that could happen a couple of times. Again, we're trying to learn from other countries, but we just don't have all the answers. In Heather's words, she knows it is painful to think that you cannot go out, or you cannot see your friends, or you cannot do whatever. But perhaps think of this. You get to keep yourself, family, and others healthy. You get to spend more quality time with your family. And you get to learn a new recipe. Read the book you've gotten to. Start your blog, or actually sit down for a minute and take a deep breath. Change your mindset on this. It helps. What does the future look like? Who knows? There have been other pandemics, but that's little reassurance in the midst of one, especially when it's not just your health, but for so many people, their livelihood on the line. Layoffs are happening left and right. Many have lost a lot of wealth in the market. Stress will weaken your immune system, just what you need functioning at peak performance right now. She doesn't know what to say about the future. Will we end up fine? Sure, hopefully, but we all may define that differently. Again, Heather says, I think it's time to stay flexible, realistic, manage your stress and anxiety the best you can, and right now, wait and see. Watch what happens in other countries and here in Washington State and New York, where we have the most illnesses. I can't thank Heather enough for putting that together for me. She is super busy, super intelligent, super educated when it comes time to ask questions like this. So I really appreciate everything that she has done to kind of calm me, and hopefully during this podcast, it helps you to understand a couple of those questions that you had unanswered. If you do have any further questions, I know that she's going to be monitoring this podcast to see if maybe you have a question of your own that you could ask her. We all have different friends that are in the medical field at different levels, but I'm fortunate enough to know that I trust Heather and her opinion and her thoughts on this. So I think without further ado, I'm going to let you ponder upon what you've heard just now and her thoughts, and lean on your best friends during this time, because that's what we have been doing. The three of us, we're texting each other back and forth. Heather will tell us a little bit about what she feels, and, without offering any of her or our political input, because that is one thing that the four of us try really hard not to incorporate in our best friendship. As you do in the workplace, stay away from politics and religion, and we'll all get along just fine. You're allowed to have your opinion, you're allowed to say what you want, but 9 times out of 10, we try really hard not to focus on things like that. So, have a wonderful day, and until next time, remember, Jax is back.
Jax is Back is brought to you in part by Queen City Family Restaurant and Visions Federal Credit Union.